Welcome back for Mental Health First Aid Part 6. Make sure to check out the previous videos to learn why mental health first aid is so valuable. In this section, we will cover some basics since knowledge is so important in understanding the struggle of others so that essential connections can be made. With understanding, empathy, and support, people struggling with mental health conditions can live full and meaningful lives. There are different ways of defining mental health. The goal for mental health treatment is to assist with the development of skills and abilities so that individuals can live independent lives where they manage and make decisions without the need for full-time clinical intervention. Despite a struggle with a mental health disorder, an individual can be considered to have good mental health where they will feel in control of their emotions, they will have good cognitive functioning, and positive interactions with others. At times when there are atypical life stressors or an individual has a diagnosed mental health disorder, the individual will struggle with relationships and daily activities. Mental health first aid is intended to help bring awareness about how impacting mental health problems can be. If one hasn't experienced overwhelming mental health struggles, they may not understand or recognize the warning signs that someone is in distress. Education and knowledge bring awareness. While we cannot read other people's minds, we can recognize the visual signs of distress. There are many slang terms being tossed around in society that do not accurately represent an individual's true mental health. Not everyone can be narcissists, however, one can exhibit traits at times in their life. Let's look at the difference between having mental health problems and having a diagnosable mental health disorder. What is a mental health disorder? It is a diagnosable illness that affects a person's thinking, emotional state, and behavior. The illness disrupts a person's ability to daily activities and often impairs their ability to work and engage in typical social activities. For the purposes of mental health first aid, we will cover the most common in a broad sense. Our goal is to recognize symptoms of distress and offer assistance to appropriate resources, not diagnose or treat an individual. This is like taking someone's hand and leading them to a person or group that matches their needs. What is a mental health problem? It describes symptoms of disorders that may not be severe enough to warrant a diagnosis of a mental disorder. The distress may feel the same to someone in crisis, however, the level of distress and length of the distress may be different. Transitions in life, such as the loss of a job or experiencing a relationship breakup, might fall in this category. With proper intervention, a person can generally learn to overcome and manage their symptoms. Everyone needs a listening ear and a nudge in the right direction at times in our lives. Stay tuned and subscribe so you don't miss future episodes. We will cover some statistics and prevalence according to studies conducted by the Substance Abuse and Mental Health Administration and other organizations. It is easier to spot changes in a person's mental health if you know them. Mental health first aid interventions aim to prevent problems from becoming more serious. The longer it takes for an individual to seek or obtain help, the more difficult recovery can be. This is an important early intervention, so please follow this series to learn the basics of mental health first aid. Maybe you notice a coworker isn't as focused as they normally are. Maybe a friend is withdrawing or isolating when they are normally very social. Maybe someone you know is making irrational decisions when they are normally very logical and methodical. Noticing the differences and asking if they are okay in itself can help. After all, they may not even realize the changes within themselves. Maybe they are just preoccupied, however, they may require benefit from professional assistance. This is where you step in. In this series, we will explore the different types of treatment and support available. Make sure to subscribe, like, and hit the notification bell so that you don't miss an episode. Some options include medical providers, medication, psychological treatments, peer support groups, rehabilitation programs, and many more. Remember, if someone appears to be unsafe, you may need to contact emergency services for immediate help. If they are at risk of harming themselves or others, either by what they are saying or how they are behaving, call 911. Safety first.